Hi Jackie, how are you doing today?
Good, how are you?
Doing well, thank you. My name is Bailey and I'm just going to ask you some questions if that's okay.
Yes.
Okay. Can you indicate why and how your interest in medicine developed?
My interest in medicine developed when I was very young. It started specifically through my little sister Brittany. She has had two strokes. She had one when she was 3 months old, and she had another stroke when she was 10. We went to go see Dr. Eileen Danko. She's a doctor in South Florida. She is an orthopedic surgeon who did surgeries on my little sister. She did two of them. The first time I met Dr. Eileen Danko, I was very amazed at her proficiency, just how empathetic she can be, and how hands on she is. I admired her, and I saw much more of her throughout the years. So I was able to develop a respect for medicine from a very young age. Before the surgeries, my little sister had very limited mobility due to her strokes. After Dr. Eileen Danko did a surgery on her left arm and her left leg to loosen up some of her tendons, my sister had more mobility, which greatly bettered my sister's life a lot, really. So through Dr. Eileen Danko and through the surgeries that happened, I was able to develop this interest for medicine.
Okay, great. What have you done to demonstrate your commitment to this profession?
While here at USF, I have done extensive amount of shadowing and volunteering. I have volunteered at Moffitt Cancer Center, the hospital on campus and the hospital off campus at McKinley. I have volunteered in multiple departments. I have volunteered in the CT scan room, in the cutaneous clinic, and the breast clinic. I have also shadowed at two different locations. I have shadowed at the ROR program, which is a USF pediatric clinic. I read to the children in the waiting room with the parents' permission for 1 hour, and then I shadow the students for another hour, for a total of 2 hours. And then I also shadow at the San Jose Mission Clinic in Dover. That is definitely more hands-on. However, since I am fluent in Spanish, I am in the room with the patient and the doctor, and I am the one who translates to and from. So I have to be very on, like, think on my feet, immediately translate what the doctor says, all of the medical terminology, translate it in Spanish, and then translate in Spanish what the patient said into English. I rotate between the two doctors. There's an OBGYN and there's a general physician doctor. However, each doctor changes by the week. So every week I shadow a different doctor. I see maybe the same one every 2 months. So I have had to adapt to the way that I need to communicate with each doctor and with each patient.
That's great. Okay. Indicate how and why you chose your major.
Freshman year at USF, my first major was biomedical science. I changed the major though my junior year to integrative human biology. I changed my major because the biomedical science degree focuses a lot on the chemical aspect, classes such as analytical chem and organic chem. I wasn't very interested in those topics. When I switched my major to integrative human biology, however, my courses focus mainly on the biological aspect of the human body, and I love it. That is what I want to study. That is what I like to read about.
That's great. Okay. How has this choice benefited you both personally and professionally?
When you first go to each class, obviously syllabus week, that's what we call it here at USF. The first day, the teacher introduces themselves and they talk about where they've studied, the research they've done, if they have more than one degree, things like that. They present the syllabus so the student knows when the due dates for the exams are, for the projects, for everything. So I have grown professionally and I have matured and I have learned to discipline myself through my teachers, through my major. I have been able to pace myself as a student and make sure that I meet my deadlines for my assignments, make sure that I am well prepared for my exams, and I am able to admire my professors for what they've been able to accomplish throughout the years of their study. So that's how.
Okay, very good. Describe your ideal life in 10 years. What will you be doing? What will your personal life be like? And what will you still be working on?
In 10 years, 2029, if everything goes according to plan, I will be in my last year of a orthopedic surgical residency. My life will consist of waking up, going to the hospital, meeting with my supervisor, doing surgeries, meeting with my supervisor again, uh, meeting with patients, being able to communicate with them and the team that I am working with efficiently. And not only being at the hospital, but back home, my life will still be revolving around medicine, as I plan it will always be. I will have to be studying for my board exams and hopefully maybe look for a fellowship if need be, things like that. That's what I see.
That's great. Okay. Describe a time when something negative happened to you or you went through something difficult, but which in hindsight can be viewed positively, and explain why.
My junior year here at USF, I was in a car accident that sprained every single muscle that holds up my neck. So, because of this accident, I was not able to show up to class. I fell behind, and I was so close to doing a medical withdrawal from every single class. I was taking biochemistry, bio 2, statistics, classes that were required for my major in order to graduate. I was very apprehensive about withdrawing from these classes because I am at USF through financial aid, pure scholarships. I need to be enrolled full time, which is 12 credit hours, which is 4 classes. And if I am not, everything is taken away from me. And without FAFSA, without my financial aid, I am unable to study. I would have to drop everything, go back home, and figure out what my next course of action would be. And that is not what I view for myself. So this was an awful experience for me. I was in constant pain, and I was very unprofessional. I wasn't the exemplary student that I feel that I am. I had to meet with teachers and explain to them my situation, my medical situation. I made sure that I had my medical proof, things like that. Not only was my neck messed up, but my discs in my spine had moved slightly. My hip had dislocated, had popped out. So I was having issues with my entire body, basically. My teachers, my bio 2 teacher and my statistics teacher, were kind enough to work with me so I could make up assignments and make sure that I wouldn't fall behind. I wasn't able, however, to catch up in my biochemistry class. I had fallen behind so much that it would have been near impossible to make up everything that I missed on. So I had to do a medical withdrawal from that one class, but I still remained in every other class. Passed, and then that summer I took biochemistry and I did excellent. I this Even though this experience was very negative, very awful for me mentally, emotionally, I see it now as something positive because through that experience, I learned that I am a person who perseveres. I'm like a steamroller machine. Like, I move forward no matter what. Most people, I guess, would have taken a step back, a semester off of school so they could physically and emotionally heal. But I made sure that I was able to do those things and still remain in school, because school to me is extremely important. I didn't want to fall behind on my medical school career plan.
That's great. Sounds like you're really dedicated.
Thank you.
Okay. How would you describe your leadership style?
My leadership style, I personally think it's very open, very communicative. I don't like leadership styles that are oppressive. I don't believe that leaders should tell people what they should be doing all the time, which is what many people think. A leader is someone who should listen to others so they can meet in the middle if compromise is needed and get things done. Get done what you set out to do.
Okay. Describe an example of when you had to adjust your leadership style to address the needs of a group.
My sophomore year, I went to a Hispanic fair event. with another friend. Since I speak fluent Spanish and so does this other friend, we were asked personally by Miss Ellen Kent, who is the USF Health volunteer coordinator here at USF, if we could attend this fair. And once we got there, you walked in, and there were multiple stations inside the room, and every single station had an activity to do with the children who would come in and the families. In another room were medical school students, USF students, and the people who came in spoke only Spanish. They are migrant workers. They work on the fields, and their children. Some of them spoke English, but not all. So at this event, Miss Ellen had to step out for a minute with to speak with the medical school students, and she left all of us, the volunteers, alone. When this happened, families started coming in. Many families, many students, not students, I'm sorry, many families, many children, and everyone was frozen in their spots. Since we were relying so much on Miss Ellen, no one really knew what the next step would be. So I took an initiative to step forward and make sure that the situation was under control. I had already introduced myself to my peers, the other volunteers, and by name I said, okay, you go here, you go here, you go here. Let's get this done. We can do it. Miss Ellen will come back, and if she wants to move us around, then we can let her do that. But we need to make sure that these people are attended to. Some students, some of my peers, told me that they would feel more comfortable at a different station. So I said, okay, no problem. You go there then, and I will go here. I compromised, and I had very open communication with them to make sure that we each were at a station and that each of us could attend to the children in the family. And when Miss Ellen came back, she actually really liked that we had already, started the event and everything was going smoothly.
Great, okay. Which do you think is a more important quality for a good health professional? To be an independent thinker or to be a team player?
I personally think it is very important to be a team player. An independent thinker doesn't work with others. They would be people who only focus on what they can do, what they can accomplish. But a team is someone who can accomplish so much more. We need to grow. Medical professionals are constantly learning something new. You never stop learning. That is what doctors have to go through every single day. There is never a day where you don't learn something. A team would be essential in any aspect. You need to communicate with nurses, with PAs. If I want to do surgery, so I would speak with my anesthesiologist. I would speak with my secretary. I would speak with the people in charge of records. I would speak with the families and the patient themselves, obviously. Being a team player ensures that you not only accomplish what you need to do, but you do it with different opinions that can bring new insight and can help you accomplish it even better.
Okay, great. And I know you mentioned that you wanted to complete an orthopedic surgery residency. Is that correct?
Yes.
Okay, so what made you choose surgery specifically?
I have been fascinated by surgery, like I said, since my little sister, since I was very young and so was she. I was fascinated by the fact that someone could study something so well and so intricately. They could perform a surgery on you and physically open you in a very safe way. And they can fix and they can move things around, muscles, tendons, organs. They can sew you back up, and after recovery, your body is better. That's what I witnessed with my little sister. She has a scar, obviously, on her left arm and leg, but after her surgery, her mobility increased so much because Dr. Eileen was able to loosen up some of her tendons in her arm and in her leg. And I want to be the type of person who can not only take time to learn these intricate human biological concepts, but apply them in such a way that I can literally change someone's life by being hands-on, by working with a team, by being able to perform something that is seen as beautiful.
That's great. Well, it sounds like you're very dedicated, and those are all the questions that I have for you. So I appreciate your time today.
Thank you. I appreciate your time as well.
Thanks.